And India has logged little over 5,000 new cases. That's 5,357 new coronavirus cases, while the active cases rose to over 32,000 according to the Health Ministry data. 11 deaths have been reported in this period. Delhi on Monday reported 484 fresh COVID-19 cases with a positivity rate which is rising and is currently at 26.58%, meaning that nearly 1 in every 4 people tested were tested positive for COVID-19. Today, the mock drill at the hospitals to check preparedness to continued as well. Let's just listen in to what my colleague has had to send.
I'm coming to you from LNJP Hospital in New Delhi. Now, the country has seen a recent upsurge in COVID cases. In the last 24 hours, India reported 5,676 new cases with a daily positivity rate of about 3.81%. However, it is important to note that those numbers are less than the numbers recorded yesterday. So yesterday we recorded about 5,880 new cases, and the positivity rate yesterday was 6.91%. If you look at Delhi's numbers, Delhi reported 484 new cases in the last 24 hours. Delhi's positivity rate, though, is very high at over 26%. So that means that every 1 in 4 people who are testing for COVID are returning a positive test result. Doctors believe that what's driving this recent upsurge is a subvariant of Omicron called XBB. They do believe that though this subvariant is very infectious, it is much milder than previous subvariants, which probably seems to suggest that the virulence of the coronavirus is decreasing successively. So that's why we've seen, hospitals across the city are reporting lower hospitalizations. In fact, many of the people who have been hospitalized were done so for pre-existing comorbidities. In light of all this, however, Union Health Minister Mansukh Mandavia has alerted all hospitals, private and government across the country, to conduct mock COVID drills in order to test the preparedness of all of these hospitals in the case of an unforeseen situation wherein there is a deluge of COVID cases in the hospital. Coming to you from New Delhi with camera person Prem Singh, this is Nayantara Singh for NDTV. I'm coming to you from the LNJP hospital in New Delhi. Now, Delhi has seen, in fact, the entire nation has seen an upsurge of COVID cases. I've got with me the MD of the hospital, Dr. Suresh Kumar. Dr. Kumar, we've seen a recent uptick in cases and, the whole nation is kind of panicking. What can you tell us about the recent upsurge? What can you tell us about the new strain?
The recent surge is because of the XBB variant and its sub-lineages. We have seen that the result of gene sequencing in the month of March and first week of April, we have seen that the majority of the cases are caused by XBB variant and its sub-variant XBB 1.16. And we have seen that although the positivity is very high, around 25%, the number of indoor hospitalization or ICU admissions are very, very less. So far we have 10 patients admitted in the Loknayak hospital. We have already discharged many of the patients who were admitted in the last week, and the recovery rate is about 98%. That is very good. And we have seen that only those patients are admitted who have some long-lasting illness, previous illness like TB, cancer, dialysis patients, uncontrolled diabetes, and we have 2 or 3 children admitted and they have recovered. Right now we have the sufficient stock of oxygen, drugs, and we have done the mock drill this morning, and everything we have checked whether the ventilators are working or not, oxygen points are functional, fully functional, and the capacity, everything we have tested today.
So you said there were a couple of children admitted in hospital, and one of the major concerns of many parents are that while there are vaccinations for kids above the age of 12, there still aren't vaccinations on the market for kids under the age of 12. So when can you see that coming out? Can you see kids being affected by this new strain? Is it a worry for them?
We have seen few of the children affected. They were admitted with pain, abdomen, diarrhea, and one child has conjunctivitis, eye problem. And subsequently the patients recovered. But it's definitely a big concern for children and the elderly population because they are at risk because of the less immunity in the extremes of the age. So definitely the vaccine is going to help them. We have seen those patients who are already received 2 doses or the booster, they have the less and less symptoms, mild symptoms, and recovery of vaccinated population is much, much better.
So can you see this upsurge lasting for a while, or can you see it, kind of going up and going down as previous waves have been?
You see, we have seen the first wave, second wave, third wave, and this current surge, and this virus is settling down. Thus, we have seen the natural history of any viral dynamics. They continue to remain in the community, but their pathogenicity, their virulence is going down. So most of these patients are recovering very well, and we have seen that the death rate is also very less this time. If you compare with the first wave or second wave, here the oxygen saturation is also not too much compromised, and majority of these patients are recovering very well. So we hope that this current surge is going to settle down soon, and we are fully prepared for this current surge.
I'm at LNGP Hospital in New Delhi, and I've got with me Deputy Medical Superintendent Dr. Ritu Saxena with me. Doctor, how many patients you have admitted in your hospital right now with COVID?
Actually, right now we have 9 patients who are admitted with us, and we have 450 beds. Out of them, 178 are ICU beds. So, not much of hospitalization is there. As when we compare with the, national data, like it's, I think more than 5,000 patients who were positive yesterday, but the hospitality rate is very low. So this is a good sign actually, because most of the patients are getting better on their own.
So what symptoms are you seeing with those who are actually hospitalized right now?
Actually, most of the patients who are hospitalized, they are having comorbidities. Some of them are pregnant, some of them are having kidney disorders, some of them are cancer patients and hypertensives, or many more. So most of these people are already somewhere admitted and they get positive, and sometimes they are at home but they are getting infected by going out. So mainly the healthy people are not getting serious symptoms. They are getting this infection, but they're becoming all right within few days.
Ma'am, have you seen a consistent rise in hospitalizations, or has it remained stable in the past few days when we have been seeing this upsurge?
Actually, this is consistent for last 1 week, because not many admissions are there. 8 or 9 or 10, not more than 11, 12 patients are admitted at a time. So this is not a very serious thing, because the number of beds is much more. So this is almost same.
One last question. Are you seeing children being admitted with the, serious COVID?
Actually, very few children who have got, other comorbidities, they are getting infected. Otherwise, only the adults, and in all the age groups, not only elderlies, but in all the age groups, the patients are there. But most of them have comorbidities.
Thank you, ma'am. So that's Dr. Saxena with me saying that hospitalizations have remained low, and it's mostly people who already have pre-existing comorbidities. So there's nothing really to worry about with this recent upsurge of COVID. In LNJP Hospital, New Delhi, with camera person Prem Singh, Nayantara Singh for NDTV.